Okay, let's talk about this glute medius hip hike. So we're starting on a step or platform, standing all the way up, leg locked out, glute squeezed, posterior pelvic tilt, hip and rib cage stacked. And we want to be in a relaxed tripod foot. So it takes a bit of practice. I'm not perfect at it myself, but equal pressure over ball of the big toe, ball of the little toe, and the heel, and trying to keep the toes relaxed and just generally not gripping too much through the foot. We're then going to lower the opposite leg down, and as we do that, we're shifting into the external lateral side of the hip. So we're literally shifting the weight laterally into that part of the hip. We're also hinging ever so slightly forward and rotating the pelvis towards that leg that we're standing on, so we get a full stretch in that glute med area. Then we're going to drive from the foot upwards. Think about pushing up as tall as you can and shortening that area as much as possible. So creating a full contraction in the glute med, which will actually externally rotate the hip and rotate the pelvis in the opposite direction. And I'm going to show you this from another angle. So leg locked out, relaxed tripod foot, rib and pelvis stacked. Keeping that leg locked out, shifting into that outside of the hip. You can almost see it kind of popping out. I'm also rotating the pelvis around that leg as well, and getting that slight hinge, so you'll really feel a stretch in the glute med. Then driving from the foot upwards as tall as possible, shortening that same area as much as possible, which will drive you upwards, externally rotate the hip, and actually cause the pelvis to rotate in the opposite direction. And then controlling back through nice and slowly, keeping that tripod foot and really trying to control the movement